Do your legs feel weak when you wake up in the morning? Do nighttime cramps jolt you awake, leaving you grabbing your calf in agony? Are you starting to worry that climbing stairs or walking long distances might become impossible as you age? If you're over 50 and nodding your head right now, you're not alone. Millions of people experience these exact same fears and frustrations every single day. But here's what most people don't realize. Those painful cramps, that growing weakness, that nagging fear of losing your independence, they're not just inevitable parts of aging. They're often signs that your body is desperately crying out for specific nutrients that most people over 60 are severely lacking. And the medical establishment? They'll tell you to eat a banana for potassium and call it a day. That's not just incomplete advice, it's dangerous. Today, I'm going to share with you the 7 most crucial vitamins that can transform your leg strength, eliminate those torturous nighttime cramps, and give you back the confidence to walk, climb, and move like you did years ago. The third vitamin on this list is completely ignored by people taking diuretics, and it might be the single most important key to ending your cramps forever. My name is Dr. Sarah Mitchell, and for the past 25 years, I've specialized in helping people over 50 reclaim their physical independence through targeted nutrition. I've seen thousands of patients transform their lives simply by addressing these specific vitamin deficiencies. Some of my patients went from barely being able to walk to their mailbox to hiking mountains in their 70s. Others eliminated decades of nighttime cramps in just weeks. But before we dive into these life-changing vitamins, let me ask you something. On a scale of 0 to 10, how strong do your legs feel right now? And more importantly, what scares you most about losing that strength? Think about it for a moment, because everything we discussed today is designed to address exactly those concerns. The truth is, your independence in your golden years depends almost entirely on the strength of your legs. Your legs are what get you out of bed in the morning, up from your favorite chair, and up those stairs to your bedroom at night. They're what keep you balanced when you reach for something on a high shelf, what carry you through the grocery store, and what give you the freedom to visit friends, travel, and enjoy life on your own terms. But here's what happens as we age that nobody talks about. It's not just that our muscles get weaker. Our entire system for absorbing, processing, and utilizing nutrients changes dramatically. Our stomach acid decreases, making it harder to extract vitamins from food. Our kidneys become less efficient at activating certain vitamins. Our skin produces less of the vitamins we need from sunlight. Even our gut bacteria, which help produce some essential vitamins, become less diverse and effective. This creates a perfect storm where the nutrients your legs need most become increasingly difficult for your body to obtain and use, right at the time when you need them more than ever. It's like trying to build a house when the supply trucks keep delivering fewer and fewer materials each day. Now, most people think cramps are just about potassium. They'll tell you to eat a banana and drink more water. But that's like trying to fix a complex machine with just a hammer. Muscle cramps, especially those agonizing nighttime ones that wake you from a deep sleep, are actually the result of a complex interaction between your muscles, nerves, circulation, and cellular energy production. Each of these systems depends on different vitamins and minerals working together in perfect harmony. When even one of these nutrients is missing or insufficient, the entire system starts to break down. Your nerves can't properly signal your muscles when to contract and when to relax. Your circulation can't deliver oxygen and nutrients efficiently. Your muscle cells can't produce the energy they need to function smoothly. The result? Those sudden, painful cramps that leave you limping and exhausted. Today we're going to explore 7 specific vitamins that address each aspect of this complex system. I'll show you exactly how to identify if you're deficient, where to find these vitamins in food, when supplementation might be necessary, and most importantly, how to do all of this safely, especially if you're taking medications. But first, let me address something crucial. Everything I share with you today is educational information designed to help you have more informed conversations with your healthcare provider before making any changes to your supplement routine, especially if you take blood thinners, diuretics, or have kidney disease. Please consult with your doctor. Some of these vitamins can interact with medications in ways that could be harmful if not properly monitored. Now let's destroy one of the most dangerous myths about leg cramps and weakness. The myth is this: cramps are just about potassium, and weak legs are just what happens when you get older. This is not only wrong, it's preventing millions of people from getting the help they need. The reality is that muscle cramps involve your nervous system's ability to properly control muscle contractions, your circulatory system's ability to deliver oxygen and nutrients, your muscle's ability to produce energy at the cellular level, and yes, your electrolyte balance. But potassium is just one small piece of a much larger puzzle. And weak legs? They're often a sign that your body lacks the specific nutrients needed to maintain muscle tissue, support nerve function, and keep your entire musculoskeletal system functioning optimally. When you understand this bigger picture, you realize why taking a potassium supplement or eating a banana might provide temporary relief, but doesn't solve the underlying problem. It's like putting a Band-Aid on a broken pipe. It might stop the immediate leak, but the pressure is still building elsewhere in the system. So let's start building a real solution, beginning with the first and perhaps most important vitamin for leg strength and cramp prevention. Vitamin number 1, vitamin D3, your foundation for muscle strength and balance. If I could only recommend one vitamin to someone over 60 concerned about leg strength and falls, it would be vitamin D3. This isn't just any vitamin. It's actually a hormone that controls over 3,000 genes in your body, many of which are directly related to muscle function, bone strength, and balance. Here's what most people don't understand about vitamin D3. It doesn't just help your body absorb calcium for strong bones. It actually binds to receptors inside your muscle cells and directly influences how well those muscles can contract and generate force. Studies have shown that people with adequate vitamin D3 levels have significantly stronger leg muscles, better balance, and are up to 40% less likely to experience falls. But here's the shocking reality. Over 70% of people over 60 are deficient in vitamin D3, and many don't even know it. As we age, our skin becomes less efficient at producing vitamin D from sunlight. We spend more time indoors. We may avoid the sun to prevent skin damage. And even when we do get sun exposure, our aging skin produces 60% less vitamin D than younger skin. How do you know if you might be deficient? The early signs are often subtle but telling. You might notice that your legs feel weaker, especially when climbing stairs or getting up from low chairs. You might experience more muscle aches and pains, particularly in your thighs and calves. Your balance might feel less steady, and you might find yourself reaching for railings or walls more often than you used to. More advanced deficiency can cause what doctors call proximal muscle weakness. This means the muscles closest to your torso, like your thighs and hips, become noticeably weaker. This is why some people struggle to get out of bathtubs, have difficulty rising from chairs without using their arms, or find that their legs feel heavy or tired, even with minimal activity. But it's not just about muscle strength. Vitamin D3 deficiency is also strongly linked to an increased risk of falls. Your inner ear, which controls balance, depends on adequate vitamin D levels to function properly. When you're deficient, your balance becomes compromised, your reaction time slows, and your risk of a serious fall increases dramatically. Now, let's talk about who's at highest risk. Obviously, people who spend most of their time indoors are at risk, but there are other factors you might not have considered. If you have darker skin, you need significantly more sun exposure to produce the same amount of vitamin D as someone with lighter skin. If you're overweight or obese, vitamin D gets sequestered in fat tissue and becomes less available to your muscles and bones. If you have kidney disease, your body can't properly activate the vitamin D you do produce. Certain medications also interfere with vitamin D metabolism. Corticosteroids, some seizure medications, and even some cholesterol-lowering drugs can reduce your body's ability to use vitamin D effectively. And if you live in the northern half of the United States, you're getting virtually no vitamin D production from sunlight for several months of the year. So where can you get vitamin D3 naturally? The best source is still sensible sun exposure. About 15 to 20 minutes of midday sun on your arms and legs several times per week can provide significant amounts of vitamin D for many people. But this needs to be balanced with skin cancer risk, and it's not practical for everyone. Food sources of vitamin D3 are more limited than most vitamins, but they do exist. Fatty fish like salmon, mackerel, sardines, and tuna are excellent sources. Wild-caught salmon contains about 600 to 1,000 international units per serving. Egg yolks from pasture-raised chickens contain more vitamin D than conventional eggs. Some mushrooms, particularly UV-exposed varieties, contain vitamin D2, though D3 is generally considered more effective. Many dairy products and some plant-based milk alternatives are fortified with vitamin D, though the amounts are often modest. A glass of fortified milk typically contains about 100 to 150 international units, which is helpful, but may not be sufficient for someone with significant deficiency. When it comes to supplementation, this is where things get both exciting and complex. Most people over 60 need significantly more vitamin D than the official recommendations suggest. While the RDA is 600 to 800 international units for adults, many experts now recommend 1,000 to 2,000 international units daily for optimal health, especially for people over 60. But here's the crucial part. Vitamin D3 works best when combined with certain other nutrients. Vitamin K2, which we'll discuss later, helps ensure that the calcium absorbed through vitamin D goes to your bones and teeth rather than your arteries. Magnesium is required for the enzymes that activate vitamin D in your body. Without adequate magnesium, even high doses of vitamin D3 may not be effective. Also, vitamin D3 is fat-soluble, which means it needs to be taken with some dietary fat to be properly absorbed. Taking it with your largest meal of the day, especially one that contains some healthy fats, will significantly improve absorption. Now, let's talk about monitoring and safety. The only way to know your true vitamin D status is through a blood test called 25-hydroxyvitamin D, or 25-OH-D. Optimal levels for muscle strength and overall health appear to be between 40 and 60 nanograms per milliliter, though some experts recommend even higher levels. This is important because both deficiency and excess can be problematic. While vitamin D toxicity is rare, it can occur with very high doses taken over extended periods. Symptoms include nausea, vomiting, weakness, and in severe cases, kidney damage. This is why working with a healthcare provider to monitor your levels is so important, especially when taking higher doses. There are also some people who need to be particularly careful with vitamin D supplementation. If you have a history of kidney stones, sarcoidosis, certain types of lymphoma, or severe kidney disease, vitamin D supplementation should only be done under medical supervision. These conditions can cause your body to absorb too much calcium, leading to dangerous elevations in blood calcium levels. But for most people over 60, adequate vitamin D3 intake represents one of the most powerful interventions for maintaining leg strength, preventing falls, and preserving independence. I've seen patients in their 70s and 80s experience dramatic improvements in their strength and balance within just a few months of optimizing their vitamin D levels. One of my patients, Margaret, came to me at age 72 because she'd fallen twice in the past year and was terrified of losing her independence. Her vitamin D level was only 18 nanograms per milliliter, severely deficient. Within 6 months of proper supplementation and monitoring, her level rose to 45 nanograms per milliliter, and she reported feeling stronger and more confident than she had in years. She's now 78 and still living independently, taking dance classes, and hasn't fallen once since optimizing her vitamin D. This brings us to our second crucial vitamin, one that's absolutely essential for proper nerve function and often overlooked in discussions about leg strength and cramps. Vitamin number 2, vitamin B12, the nerve protector that stops tingling and weakness. If vitamin D3 is the foundation of muscle strength, then vitamin B12 is the electrical system that makes everything work. Your muscles are only as strong as the nerves that control them, and vitamin B12 is absolutely essential for maintaining healthy nerve function throughout your body. Here's what happens when you're deficient in B12. Your nerves literally begin to deteriorate. The protective coating around your nerve fibers, called myelin, starts to break down. This leads to symptoms that many people dismiss as just getting older: tingling in the feet and legs, numbness, a sensation of pins and needles, muscle weakness, and yes, an increased tendency toward muscle cramps. But B12 deficiency goes much deeper than just uncomfortable sensations. When your nerves can't properly communicate with your muscles, those muscles become weak and uncoordinated. Your balance suffers because the nerves that carry information from your feet to your brain about your position in space aren't functioning properly. You might find yourself stumbling more often, feeling unsteady on uneven surfaces, or having difficulty with fine motor control. The tragedy is that B12 deficiency is incredibly common in people over 60, yet it's often missed by healthcare providers because the symptoms develop so gradually and can mimic so many other conditions. Some estimates suggest that up to 40% of people over 60 have insufficient B12 levels, and many of them don't even know it. Why is B12 deficiency so common as we age? The answer lies in how this complex vitamin is absorbed by your body. Unlike most vitamins, B12 requires a very specific and complicated process to get from your food into your bloodstream. First, your stomach must produce enough acid to separate B12 from the proteins in food. Then, your stomach must produce a substance called intrinsic factor, which binds to B12 and allows it to be absorbed in your small intestine. As we age, our stomach acid production naturally decreases. This condition, called hypochlorhydria, makes it much harder to extract B12 from food. Additionally, many people over 60 take acid-reducing medications like proton pump inhibitors or H2 blockers for heartburn or ulcers. While these medications can be important for treating certain conditions, they significantly reduce B12 absorption. But acid reduction isn't the only problem. Many common medications interfere with B12 absorption or metabolism. Metformin, which is widely prescribed for diabetes, can reduce B12 absorption by up to 30%. This is particularly concerning because diabetes itself can cause nerve damage, and B12 deficiency can make this much worse. Other medications that can interfere with B12 include certain antibiotics, seizure medications, and even some blood pressure medications. If you're taking multiple medications, and most people over 60 are, your risk of B12 deficiency increases significantly. There are also certain health conditions that dramatically increase your risk of B12 deficiency. Atrophic gastritis, which is inflammation and thinning of the stomach lining, makes it nearly impossible to absorb B12 from food. This condition becomes more common with age and is often associated with H. pylori infections or autoimmune conditions. People who follow vegetarian or vegan diets are at particularly high risk because B12 is found almost exclusively in animal products. While plant-based diets can be very healthy, they require careful attention to B12 supplementation, especially as people age and absorption becomes more challenging. Celiac disease, Crohn's disease, and other conditions that affect the small intestine can also impair B12 absorption. Even moderate alcohol consumption can interfere with B12 metabolism and storage in the liver. So how do you know if you might be B12 deficient? The early symptoms often involve your nerves and can be subtle at first. You might notice tingling or numbness in your feet or hands, particularly at night. Your legs might feel weak or heavy, especially when climbing stairs or walking long distances. You might experience more muscle cramps than usual or notice that minor cuts or scrapes take longer to heal. As deficiency progresses, symptoms become more pronounced. You might develop what's called peripheral neuropathy, numbness and tingling that starts in your feet and gradually moves up your legs. Your balance might become noticeably worse, and you might find yourself feeling dizzy or unsteady more often. B12 deficiency can also cause cognitive symptoms that many people attribute to normal aging. Memory problems, difficulty concentrating, confusion, and mood changes can all be signs of insufficient B12. Some people experience what feels like depression or anxiety that doesn't respond well to traditional treatments. One of the most serious consequences of long-term B12 deficiency is permanent nerve damage. Unlike some vitamin deficiencies that can be quickly reversed with supplementation, nerve damage from B12 deficiency can become irreversible if left untreated for too long. This is why early detection and treatment are so crucial. The best food sources of B12 are all animal products. Beef liver is by far the richest source, containing over 70 micrograms per serving. That's nearly 3,000% of the daily recommended amount. But you don't need to eat liver to get adequate B12. Other excellent sources include clams and mussels, which contain even more B12 than liver, though they're not as commonly consumed. More practical sources include beef, particularly grass-fed beef, which contains about 6 micrograms per serving. Fish like salmon, tuna, and sardines are excellent sources, providing 2 to 5 micrograms per serving. Eggs contain about 1 microgram per egg, mainly in the yolk. Dairy products like milk, cheese, and yogurt contain modest amounts of B12. The challenge is that even if you eat these foods regularly, you might still develop deficiency if your absorption is impaired. This is why many people over 60 benefit from B12 supplementation, even if their diet seems adequate. When it comes to supplementation, B12 is unique among vitamins in several ways. First, it's virtually impossible to take too much B12 because it's water-soluble and excess amounts are simply excreted in urine. This makes it one of the safest vitamins to supplement with, even in high doses. Second, there are several different forms of B12 available, and some are more effective than others for people with absorption problems. The most common form in supplements is cyanocobalamin, which is synthetic but very stable and well-studied. However, for people with absorption issues, methylcobalamin or adenosylcobalamin may be more effective because they're in forms that your body can use directly without additional processing. For people with significant absorption problems, sublingual, under the tongue, or nasal spray forms of B12 can be much more effective than pills that need to go through the digestive system. These forms allow B12 to be absorbed directly into the bloodstream through the mucous membranes in your mouth or nose. In cases of severe deficiency, B12 injections may be necessary. These bypass the digestive system entirely and can rapidly restore B12 levels even in people with severe absorption problems. Many of my patients have been amazed at how quickly their symptoms improve with B12 injections, often within just a few weeks. The dosage of B12 needed varies widely depending on the severity of deficiency and the individual's ability to absorb it. For maintenance in people without absorption problems, 25 to 100 micrograms daily is usually sufficient. For people with absorption issues or existing deficiency, doses of 500 to 1,000 micrograms daily may be needed, at least initially. Testing for B12 deficiency is more complex than you might think. The standard blood test for B12 can be misleading because it measures total B12 in the blood, not necessarily how much is available for your cells to use. Some people can have normal B12 levels on testing, but still have functional B12 deficiency. More sophisticated tests include methylmalonic acid, MMA, and homocysteine levels. These substances build up in the blood when B12 is insufficient, even when standard B12 levels appear normal. If you're experiencing symptoms that could be related to B12 deficiency, it's worth asking your doctor about these additional tests. The importance of correcting B12 deficiency cannot be overstated. I've seen patients whose leg weakness and balance problems were attributed to arthritis or just getting older experience dramatic improvement once their B12 levels were optimized. The key is not waiting until symptoms become severe. Early intervention can prevent permanent nerve damage and preserve your mobility and independence. This brings us to our third vitamin, one that's particularly important for people taking diuretics, and one that could be the key to eliminating your cramps forever. Vitamin number 3, vitamin B1 thiamine, the hidden key that diuretic users ignore. If you're taking a diuretic for blood pressure or heart problems and you're still struggling with muscle cramps, weakness, or fatigue, this section could change your life. Vitamin B1, also known as thiamine, is the vitamin that most people taking water pills are unknowingly depleting from their bodies, and it might be the missing piece in your battle against leg cramps and weakness. Here's what thiamine does that makes it so crucial for your legs. It's absolutely essential for converting the food you eat into energy that your muscles and nerves can use. Every single muscle contraction, every nerve impulse, every heartbeat depends on thiamine to help convert glucose into usable energy. Without adequate thiamine, your muscles literally can't function properly, leading to weakness, cramps, and that overwhelming fatigue that makes even simple activities feel exhausting. But thiamine does something else that's particularly important for preventing cramps. It's essential for for proper nerve function. When your nerves can't communicate effectively with your muscles, those muscles become more prone to involuntary contractions. In other words, cramps. Thiamine deficiency can cause what doctors call peripheral neuropathy, which often starts as tingling and weakness in the feet and legs and can progress to painful cramps and significant muscle weakness. Now you might be thinking, I eat a balanced diet, so I must be getting enough thiamine. But here's the problem. Thiamine deficiency is much more common than most people realize, especially in certain populations. And if you're taking a diuretic, your risk skyrockets. Diuretics, particularly loop diuretics like furosemide Lasix, and thiazide diuretics like hydrochlorothiazide, cause your kidneys to excrete more water and sodium. But they also cause you to lose significant amounts of water-soluble vitamins, including thiamine. The longer you've been taking these medications and the higher the dose, the greater your risk of developing thiamine deficiency. The tragedy is that most people taking diuretics are never warned about this risk, and their doctors rarely monitor thiamine levels. So they continue taking their necessary heart or blood pressure medication while gradually developing a deficiency that causes the very symptoms they're trying to avoid: weakness, fatigue, and muscle cramps. But diuretic use isn't the only risk factor for thiamine deficiency. Alcohol consumption, even moderate amounts, significantly increases your thiamine needs because alcohol interferes with thiamine absorption and storage. If you're over 60 and enjoy a glass of wine with dinner or a cocktail in the evening, your thiamine requirements are higher than someone who doesn't drink at all. People with heart failure are at particularly high risk for thiamine deficiency, and not just because they're often taking diuretics. The heart failure condition itself increases thiamine needs, and the dietary restrictions often recommended for heart failure patients can inadvertently reduce thiamine intake. Diabetes also increases thiamine needs because high blood sugar levels increase the excretion of thiamine through the kidneys. This creates a vicious cycle. Diabetes can lead to thiamine deficiency, which can worsen nerve damage and muscle function, making diabetes management even more challenging. The modern diet is another major risk factor for thiamine deficiency. Thiamine is found primarily in whole grains, but most of the grains consumed in the Western diet are refined. White bread, white rice, and processed cereals are stripped of their thiamine content during processing. While some products are fortified with thiamine, the amounts may not be sufficient for people with increased needs due to medications or health conditions. So what are the signs that you might be thiamine deficient? The early symptoms are often subtle and nonspecific, which is why this deficiency is so often missed. You might notice that you feel more tired than usual, especially after meals when your body is trying to convert food into energy. Your legs might feel heavy or weak, particularly when climbing stairs or walking longer distances. Muscle cramps, especially in the calves and feet, can be an early sign of thiamine deficiency. These cramps might be more frequent at night or after physical activity. You might also notice that your appetite isn't what it used to be, or that you feel nauseous occasionally, particularly in the morning. As thiamine deficiency progresses, symptoms become more pronounced. You might develop what feels like peripheral neuropathy, tingling, numbness, or burning sensations in your feet and legs. Your balance might become affected, and you might find yourself feeling dizzy or unsteady, particularly when standing up quickly. In severe cases, thiamine deficiency can cause a condition called beriberi, which can affect either the nervous system, dry beriberi, or the cardiovascular system, wet beriberi. Dry beriberi causes progressive weakness and muscle wasting, particularly in the legs. Wet beriberi can cause fluid retention and heart problems. While severe beriberi is rare in developed countries, subclinical thiamine deficiency that causes fatigue, weakness, and cramps is much more common than most people realize. The best food sources of thiamine are whole grains, legumes, nuts, and seeds. Pork is an excellent source, containing about 1 milligram per serving. Sunflower seeds, sesame seeds, and tahini are rich in thiamine. Black beans, lentils, and other legumes provide significant amounts. Whole wheat products contain much more thiamine than their refined counterparts. Nutritional yeast, which is popular among vegetarians and vegans, is often fortified with thiamine and can be an excellent source. Pine nuts, macadamia nuts, and Brazil nuts also contain meaningful amounts of thiamine. However, thiamine is one of the most fragile vitamins. It's destroyed by heat, light, and alkaline conditions. This means that cooking methods can significantly affect the thiamine content of foods. Steaming or microwaving preserves more thiamine than boiling. Fresh foods generally contain more thiamine than those that have been stored for long periods. When it comes to supplementation, thiamine is generally very safe because it's water-soluble and excess amounts are excreted in urine. For people at risk of deficiency, particularly those taking diuretics, doses of 50 to 100 milligrams daily are often used therapeutically. There are different forms of thiamine available in supplements. Standard thiamine hydrochloride is the most common and least expensive form. However, some people may benefit from fat-soluble forms like benfotiamine, which may be better absorbed and may have additional benefits for nerve health. For people with severe deficiency or absorption problems, thiamine injections may be necessary initially. These can rapidly restore thiamine levels and often lead to dramatic improvement in symptoms within days to weeks. The timing of thiamine supplementation can be important. Because thiamine is involved in energy metabolism, taking it with meals can help optimize its utilization. If you're taking a diuretic, it's often recommended to take thiamine at a different time to minimize any potential interaction, though this is generally not a major concern. One important consideration is that thiamine works closely with other B vitamins. Taking high doses of one B vitamin can sometimes create relative deficiencies in others. This is why many practitioners recommend taking a B-complex supplement rather than just isolated thiamine, especially for long-term use. Testing for thiamine deficiency can be done through blood tests, but these aren't routinely ordered unless deficiency is suspected. The most accurate test measures thiamine activity in red blood cells, but this specialized test isn't available in all labs. For many people, especially those taking diuretics, a trial of thiamine supplementation under medical supervision can be both diagnostic and therapeutic. If symptoms improve with supplementation, it suggests that thiamine deficiency was contributing to the problems. The connection between thiamine and muscle cramps is particularly important for people taking diuretics. I've seen numerous patients whose nighttime leg cramps disappeared within weeks of starting thiamine supplementation, after years of suffering and trying various other remedies. One of my patients, Robert, had been taking a diuretic for heart failure for over 5 years. He complained of constant fatigue, weakness in his legs, and cramps that would wake him up several nights a week. His doctors had tried adjusting his other medications and recommended stretching exercises, but nothing helped. Within 3 weeks of starting thiamine supplementation, his energy improved dramatically, his leg strength returned, and his cramps virtually disappeared. This brings us to our fourth vitamin, another B vitamin that plays a crucial role in nerve and muscle function. Vitamin number 4, Vitamin B6 Pyridoxine, the neuromuscular communication specialist. Vitamin B6, also known as pyridoxine, is like the translator that helps your nervous system and muscular system communicate effectively. While it might not get as much attention as some other vitamins, B6 plays absolutely crucial roles in preventing muscle cramps, maintaining nerve health, and supporting the biochemical processes that keep your legs strong and functional. Here's what makes B6 so important for your legs. It's essential for the production of neurotransmitters, the chemical messengers that allow your nerves to communicate with your muscles. When you decide to take a step, climb stairs, or shift your weight, your brain sends signals through your nervous system to coordinate precise muscle contractions. This entire process depends on having adequate B6 to produce the neurotransmitters that make this communication possible. B6 is also crucial for protein metabolism, which is directly relevant to maintaining muscle mass and strength as we age. Your muscles are constantly breaking down and rebuilding protein structures, and this process requires adequate B6. Without it, your muscles can't maintain themselves properly, leading to gradual weakness and increased susceptibility to cramps and injury. But perhaps most importantly, for people struggling with nighttime cramps, B6 is involved in the regulation of muscle contractions. Some research suggests that B6 deficiency can contribute to muscle hyperexcitability, a condition where muscles are more likely to contract involuntarily, causing cramps. This is particularly relevant for nighttime cramps, which often occur when muscles are at rest and normal regulatory mechanisms may be less active. B6 deficiency becomes more common as we age for several reasons. Our ability to absorb and utilize B6 decreases with age, particularly if we have any digestive issues or take medications that interfere with B vitamin absorption. Additionally, B6 requirements may increase with age due to chronic inflammation, which is common in older adults and increases the body's need for various nutrients. Certain medications significantly increase the risk of B6 deficiency. Isoniazid, which is used to treat tuberculosis, is well known for causing B6 deficiency. Some blood pressure medications, particularly hydralazine, can interfere with B6 metabolism. Even birth control pills, which some women continue using into their 60s, can reduce B6 levels. People with kidney disease are at particularly high risk for B6 deficiency because the kidneys play an important role in B6 metabolism. Dialysis patients often require B6 supplementation because the dialysis process removes B6 from the blood. Alcohol consumption also significantly increases B6 needs and interferes with B6 utilization. This is particularly relevant for older adults who might be using alcohol to help with sleep or anxiety, not realizing that it could be contributing to their muscle cramps and weakness. The signs of B6 deficiency can be subtle initially, but become more pronounced over time. Early symptoms often include fatigue, irritability, and mood changes. You might notice that you feel more anxious or depressed than usual, or that you're having trouble sleeping. These psychological symptoms occur because B6 is essential for producing serotonin and other neurotransmitters that regulate mood and sleep. Physical symptoms of B6 deficiency often start with the extremities. You might notice tingling or numbness in your hands and feet, similar to what occurs with B12 deficiency. Your muscles might feel weaker than usual, and you might experience more cramps, particularly at night. In more advanced deficiency, you might develop what doctors call peripheral neuropathy. This can cause pain, numbness, and weakness that typically starts in the feet and gradually moves up the legs. the skin might become more sensitive, and you might notice that light touch or clothing feels uncomfortable. B6 deficiency can also affect your immune system, making you more susceptible to infections. You might notice that you catch colds more frequently, or that minor cuts and scrapes take longer to heal than they used to. Good food sources of B6 include poultry, particularly chicken and turkey, which contain about 1 milligram per serving. Fish like salmon, tuna, and halibut are excellent sources. Potatoes, particularly when eaten with the skin, provide significant amounts of B6. Bananas are often mentioned as a B6 source, though the amounts are modest compared to other foods. Chickpeas and other legumes are excellent plant-based sources of B6. A cup of chickpeas provides about 1 milligram of B6, which is a significant portion of the daily requirement. Sunflower seeds, sesame seeds, and tahini are also good sources. Organ meats, particularly liver, contain very high amounts of B6, but these aren't commonly consumed in modern diets. For people who do eat organ meats, they're an excellent way to obtain not just B6, but many other nutrients that become more important with age. Like other B vitamins, B6 can be destroyed by cooking, particularly boiling. Steaming, baking, or grilling tends to preserve more B6 than boiling. Fresh foods generally contain more B6 than processed or stored foods. When it comes to supplementation, B6 requires more caution than some other B vitamins because it's possible to take too much. While B6 toxicity is rare, it can occur with very high doses taken over extended periods. The main concern is that excessive B6 can actually cause the very symptoms you're trying to prevent: peripheral neuropathy with numbness and tingling in the hands and feet. For most adults, including older adults, the recommended daily amount of B6 is about 1.3 to 1.7 milligrams. For people at risk of deficiency or those with increased needs due to medications or health conditions, doses of 25 to 50 milligrams daily are often used therapeutically. However, doses above 100 milligrams daily should generally be avoided unless specifically recommended by a healthcare provider for a particular medical condition. Some supplements contain much higher amounts than this, so it's important to read labels carefully. There are different forms of B6 available in supplements. The most common form is pyridoxine hydrochloride, which is synthetic but well absorbed by most people. However, some people may benefit from pyridoxal 5-phosphate P5P, which is the active form that your body uses directly. This can be particularly helpful for people with genetic variations that affect B6 metabolism, or those with digestive issues that might interfere with the conversion of pyridoxine to its active form. The timing of B6 supplementation can affect its effectiveness. Because B6 is involved in neurotransmitter production, taking it in the morning may help with energy and mood throughout the day. However, some people find that B6 helps with sleep quality, in which case taking it in the evening might be more beneficial. B6 works synergistically with other B vitamins, particularly B12 and folate. These three vitamins work together to regulate homocysteine levels, an amino acid that, when elevated, is associated with increased risk of heart disease and stroke. This is another reason why many healthcare providers recommend B-complex supplements rather than isolated B vitamins for long-term use. Testing for B6 status can be done through blood tests, though these aren't routinely ordered unless deficiency is suspected. The most accurate test measures pyridoxal phosphate, the active form of B6 in the blood. For people struggling with nighttime muscle cramps, B6 supplementation can be particularly helpful. Some studies have shown that B6, either alone or in combination with other B vitamins, can reduce the frequency and severity of muscle cramps, particularly those that occur at night. I've seen many patients whose quality of life improved significantly once their B6 status was optimized. One patient, Dorothy, was 73 and had been waking up with painful calf cramps almost every night for over a year. She tried stretching, heating pads, and various over-the-counter remedies with little success. After starting a B-complex supplement that included 25 milligrams of B6, her cramps decreased dramatically within about 6 weeks, and she was finally able to sleep through the night again. It's worth noting that B6 deficiency rarely occurs in isolation. Most people who are deficient in B6 are also deficient in other B vitamins. This is why the symptoms of B vitamin deficiencies often overlap, and why comprehensive testing and treatment is usually most effective. This brings us to our fifth vitamin, one that's particularly important for muscle health and circulation. Vitamin number 5, vitamin E, the muscle protector and circulation enhancer. Vitamin E might not be the first vitamin you think of when it comes to leg strength and cramp prevention, but it plays several crucial roles that directly impact your muscle function and circulation. As a powerful antioxidant, vitamin E protects your muscle fibers from the damage that occurs during normal use and aging, while also supporting the blood circulation that keeps your muscles nourished and functioning optimally. Here's what makes vitamin E so important for your legs. Every time your muscles contract, they produce free radicals as a natural byproduct of energy production. These free radicals, if not neutralized, can damage muscle fibers and contribute to weakness, fatigue, and increased susceptibility to injury. Vitamin E acts as your muscle's primary defense against this oxidative damage, helping to maintain muscle strength and function as you age. But vitamin E does more than just protect muscle tissue. It also plays a crucial role in maintaining healthy circulation, particularly in the small blood vessels that supply your muscles with oxygen and nutrients. Good circulation is essential for preventing cramps because muscles that don't receive adequate oxygen and nutrients are much more likely to go into spasm. Vitamin E deficiency, while relatively rare in healthy individuals, can cause significant muscle problems. In severe cases, it can lead to muscle weakness, difficulty walking, and what doctors call myopathy, a general term for muscle disease. The muscles most commonly affected are those in the legs and arms, which can become progressively weaker over time. Even mild vitamin E insufficiency can contribute to muscle fatigue, reduced exercise tolerance, and increased susceptibility to muscle cramps. This is particularly relevant for older adults, whose antioxidant needs may be higher due to increased inflammation and oxidative stress that comes with aging. Who's at risk for vitamin E deficiency? Unlike water-soluble vitamins that can be easily depleted, vitamin E is fat-soluble and stored in your body's fat tissue. However, this also means that people with conditions that affect fat absorption are at higher risk for deficiency. People with digestive disorders like celiac disease, Crohn's disease, or chronic pancreatitis may have difficulty absorbing vitamin E from food. Those who have had gastric bypass surgery or other procedures that alter the digestive system may also be at risk. Liver disease can affect vitamin E storage and metabolism because the liver plays a crucial role in processing fat-soluble vitamins. People with severe liver disease may develop vitamin E deficiency even if their dietary intake is adequate. Certain genetic conditions can also affect vitamin E metabolism, though these are relatively rare. More commonly, people who follow very low-fat diets for extended periods may not consume enough dietary fat to adequately absorb the vitamin E they do consume. The signs of vitamin E deficiency often develop gradually and can be subtle initially. You might notice that your muscles feel weaker than usual, particularly during or after physical activity. Your exercise tolerance might decrease, and you might find that activities that were once easy now leave you feeling unusually fatigued. Muscle cramps, particularly in the legs, can be a sign of vitamin E insufficiency. These cramps might occur during activity or at rest, and they might be accompanied by muscle tenderness or soreness that persists longer than usual after exercise. In more advanced cases, vitamin E deficiency can cause neurological symptoms because nerve tissue is particularly vulnerable to oxidative damage. You might notice problems with coordination, balance, or muscle control. Reflexes might become abnormally brisk or diminished. Vision problems can also occur with severe vitamin E deficiency, though this is more common in children than adults. The retina is particularly vulnerable to oxidative damage, and vitamin E helps protect the delicate structures of the eye. Excellent food sources of vitamin E include nuts and seeds, particularly sunflower seeds, almonds, and hazelnuts. A quarter cup of sunflower seeds provides about 90% of the daily vitamin E requirement. Almonds are another excellent source, with an ounce providing about 7 milligrams of vitamin E. Plant oils are some of the richest sources of vitamin E, particularly wheat germ oil, sunflower oil, and safflower oil. However, it's important to choose oils that are cold-pressed and stored properly because vitamin E is sensitive to heat and light and can be destroyed during processing. Avocados are an excellent whole food source of vitamin E, providing about 3 milligrams per medium fruit. They also provide the healthy fats needed for optimal vitamin E absorption. Green leafy vegetables like spinach and Swiss chard contain meaningful amounts of vitamin E, though not as much as nuts and seeds. Broccoli, asparagus, and other green vegetables also contribute to vitamin E intake. Fish like salmon and trout contain some vitamin E, though not as much as plant sources. The vitamin E in fish is often in a different form than that found in plants, and both forms contribute to your overall vitamin E status. When it comes to cooking and food preparation, it's important to remember that vitamin E is sensitive to heat, light, and air. Storing nuts and seeds in cool, dark places helps preserve their vitamin E content. Using oils soon after opening and storing them in the refrigerator can help maintain their vitamin E levels. Supplementation with vitamin E can be beneficial for some people, but it's more complex than supplementing with water-soluble vitamins. Vitamin E exists in several different forms, and the form matters for its effectiveness. Natural vitamin E, often listed as D-alpha tocopherol, is generally considered more effective than synthetic forms, DL-alpha tocopherol. However, vitamin E supplements often contain only alpha tocopherol, while foods contain a mixture of tocopherols and tocotrienols that may work together synergistically. For most adults, doses of 15 to 30 milligrams, about 22 to 45 international units, daily are sufficient for maintaining adequate vitamin E status. Higher doses may be beneficial for people with increased oxidative stress due to smoking, pollution exposure, or certain medical conditions, but these should be used under medical supervision. It's important to be cautious with high-dose vitamin E supplements, particularly if you're taking blood-thinning medications like warfarin or aspirin. Vitamin E can enhance the effects of these medications, potentially increasing the risk of bleeding. This interaction can be significant, so anyone taking anticoagulant medications should consult with their healthcare provider before taking vitamin E supplements. Some studies have raised concerns about very high doses of vitamin E, above 400 IU daily, potentially increasing mortality risk, though these studies had limitations and the results remain controversial. The key is finding the right balance, enough to support muscle health and antioxidant protection without going to potentially harmful extremes. Vitamin E works best when combined with other antioxidants. Vitamin C helps regenerate vitamin E after it's been used to neutralize free radicals, making both vitamins more effective. Selenium is another nutrient that works synergistically with vitamin E to protect against oxidative damage. Testing for vitamin E status isn't routinely done unless deficiency is suspected, but it can be measured through blood tests if needed. Most people can maintain adequate vitamin E status through a diet that includes nuts, seeds, and healthy oils. For people struggling with muscle weakness or cramps, optimizing vitamin E intake through food sources is often a safe and effective approach. I've seen patients whose muscle recovery improved and cramping decreased when they increased their intake of vitamin E-rich foods like almonds and sunflower seeds. This brings us to our sixth vitamin, one that's essential for the structural integrity of your muscles and blood vessels. Vitamin number 6, vitamin C, the collagen builder and circulation booster. When most people think of vitamin C, they think of preventing colds or boosting immune function. But vitamin C plays several crucial roles in maintaining leg strength and preventing muscle cramps that most people never consider. As the primary vitamin responsible for collagen synthesis, vitamin C is literally building the structural foundation that holds your muscles, tendons, and blood vessels together. Here's why this matters so much for your legs. Collagen isn't just important for your skin. It's a crucial component of your tendons, ligaments, and blood vessel walls. Strong, healthy tendons are essential for transmitting the force your muscles generate into movement. When your tendons are weak or damaged due to inadequate collagen production, your muscles have to work harder to achieve the same results, leading to fatigue, weakness, and increased risk of cramps. But vitamin C's role in leg health goes even deeper. It's essential for the synthesis of carnitine, a compound that helps your muscle cells produce energy efficiently. Without adequate carnitine, your muscles can't effectively burn fat for fuel, leading to early fatigue and reduced endurance. This is particularly important as we age because our muscles' ability to use oxygen and produce energy naturally declines. Vitamin C also dramatically improves iron absorption from plant sources. Iron is crucial for carrying oxygen to your muscles, and iron deficiency can cause muscle weakness, fatigue, and restless leg syndrome. By enhancing iron absorption, vitamin C helps ensure that your muscles receive the oxygen they need to function properly and avoid cramping. Additionally, vitamin C is a powerful antioxidant that works alongside vitamin E to protect your muscle tissue from oxidative damage. It also helps regenerate vitamin E after it's been used, making both vitamins more effective at protecting your muscles. The circulation benefits of vitamin C are particularly important for preventing cramps. Vitamin C helps maintain the health of your blood vessel walls, ensuring that blood can flow efficiently to your muscles. It also supports the production of nitric oxide, a compound that helps blood vessels relax and dilate, improving blood flow to working muscles. Vitamin C deficiency is more common than many people realize, particularly among older adults. While severe deficiency scurvy is rare in developed countries, subclinical deficiency that can contribute to muscle problems and poor wound healing is much more common. Several factors increase the risk of vitamin C deficiency as we age. Our ability to absorb vitamin C may decrease with age, particularly if we have any digestive issues. Additionally, stress, whether physical, emotional, or from illness, dramatically increases vitamin C needs. Many older adults are dealing with chronic health conditions, medications, or life stressors that can deplete vitamin C stores. Smoking is one of the most significant risk factors for vitamin C deficiency. Smokers need at least 35 milligrams more vitamin C per day than non-smokers, and even people who quit smoking may have increased needs for years afterward as their bodies repair damage from smoking. Certain medications can also affect vitamin C status. Aspirin and other NSAIDs can increase vitamin C excretion. Some chemotherapy drugs deplete vitamin C. Even oral contraceptives, which some women continue using into their 50s and 60s, can reduce vitamin C levels. People with kidney disease may have altered vitamin C metabolism and may need to limit vitamin C intake, while those on dialysis may have increased needs because the dialysis process removes vitamin C from the blood. The signs of vitamin C insufficiency often start subtly. You might notice that cuts and scrapes take longer to heal than they used to. Your skin might seem less elastic or more prone to bruising. Gums might become tender or bleed more easily when brushing teeth. Muscle-related symptoms of vitamin C deficiency include fatigue, weakness, and muscle pain, particularly in the legs. You might notice that your exercise tolerance decreases or that you feel unusually tired after physical activity. Joint pain and stiffness can also occur because vitamin C is essential for maintaining healthy cartilage. In more advanced deficiency, symptoms can include swollen, painful joints, poor wound healing, and frequent infections. The classic signs of scurvy, bleeding gums, loose teeth, and skin hemorrhages are rare but can occur in severe cases. Excellent food sources of vitamin C are found primarily in fruits and vegetables. Citrus fruits are well-known sources, but many other foods contain even higher amounts. Red bell peppers contain more vitamin C per serving than oranges. A medium red pepper provides about 150 milligrams of vitamin C, which is nearly twice the daily recommended amount. Strawberries are an excellent source, with 1 cup providing about 85 milligrams. Kiwi fruit is particularly rich in vitamin C, with 1 medium fruit providing about 70 milligrams. Papaya, guava, and cantaloupe are also excellent sources. Among vegetables, broccoli, Brussels sprouts, and cauliflower are excellent sources of vitamin C. Dark leafy greens, like kale and spinach, also provide significant amounts. Tomatoes, particularly when eaten raw, contribute meaningful amounts of vitamin C to the diet. One of the richest natural sources of vitamin C is acerola cherry, though this isn't commonly available fresh in most areas. Camu camu, another South American fruit, is even richer in vitamin C, but is mainly available as a powder or supplement. It's important to note that vitamin C is one of the most fragile vitamins. It's easily destroyed by heat, light, and air exposure. Fresh fruits and vegetables contain much more vitamin C than those that have been stored for long periods. Cooking methods matter too. Steaming or microwaving preserves more vitamin C than boiling. Raw foods generally contain the most vitamin C, which is why including fresh fruits and vegetables in your daily diet is so important. Even storing cut fruits and vegetables in the refrigerator can cause significant vitamin C loss over time. When it comes to supplementation, vitamin C is generally very safe because it's water-soluble and excess amounts are excreted in urine. However, very high doses can cause digestive upset, including diarrhea, nausea, and stomach cramps. For most adults, the recommended daily amount is 75 to 90 milligrams, though many experts believe higher amounts may be beneficial, particularly for older adults or those with increased needs due to stress, smoking, or illness. Doses of 200 to 500 milligrams daily are commonly used and are generally well tolerated. Some people take much higher doses, but there's little evidence that doses above 1,000 milligrams daily provide additional benefits for most people. There are different forms of vitamin C available in supplements. Ascorbic acid is the most common and least expensive form. Sodium ascorbate or calcium ascorbate may be easier on the stomach for people who experience digestive upset with regular ascorbic acid. Some supplements contain vitamin C with bioflavonoids, which are compounds found naturally in fruits that may enhance vitamin C absorption and effectiveness. While the evidence for this is limited, these combinations are generally safe and may provide additional antioxidant benefits. The timing of vitamin C supplementation can affect absorption. Because vitamin C is water-soluble and doesn't stay in the body very long, dividing doses throughout the day may be more effective than taking one large dose. Taking vitamin C with meals can help reduce the risk of stomach upset. For people with iron deficiency or who want to maximize iron absorption from plant sources, taking vitamin C with iron-rich meals can be very beneficial. A glass of orange juice with a spinach salad or a tomato-based sauce with beans can significantly increase iron absorption. One important consideration is that people with a history of kidney stones, particularly calcium oxalate stones, should be cautious with high-dose vitamin C supplements. Vitamin C can be converted to oxalate in the body, potentially increasing stone formation risk in susceptible individuals. Testing for vitamin C status can be done through blood tests, though these aren't routinely ordered unless deficiency is suspected. Most people can maintain adequate vitamin C status by including several servings of fruits and vegetables in their daily diet. For people struggling with muscle weakness, poor wound healing, or frequent infections, optimizing vitamin C intake can make a significant difference. I've seen patients whose energy levels improved and muscle recovery enhanced when they increased their intake of vitamin C-rich foods. This brings us to our seventh and final vitamin, one that might be the most important for ensuring that calcium goes where it should, to your bones and teeth rather than your arteries. Vitamin number 7, vitamin K2, the calcium director and bone strength guardian. Vitamin K2 is perhaps the most underappreciated vitamin when it comes to leg strength and overall musculoskeletal health. While most people have never heard of K2 or confuse it with vitamin K1, this remarkable nutrient plays a crucial role in directing calcium to where it belongs in your body, your bones and teeth, while preventing it from accumulating where it doesn't belong, your arteries and soft tissues. Here's why this matters so much for your legs and overall health. As we age, many people develop what's called the calcium paradox. Despite taking calcium supplements or eating calcium-rich foods, their bones become weaker while their arteries become more calcified and stiff. This happens because calcium needs specific proteins to direct it to the right places in the body, and vitamin K2 is essential for activating these proteins. Strong bones are obviously crucial for leg strength and stability, but the vascular benefits of K2 are equally important. When your arteries become calcified and stiff, blood flow to your muscles decreases. This can lead to muscle fatigue, cramps, and reduced exercise tolerance. By keeping your arteries flexible and clear, K2 helps ensure that your leg muscles receive the blood flow they need to function optimally. Vitamin K2 also appears to play a direct role in muscle function. Some research suggests that K2 is involved in energy production within muscle cells and may help maintain muscle mass as we age. While this research is still emerging, It adds another layer to why K2 might be important for maintaining leg strength and preventing muscle weakness. There are actually several different forms of vitamin K2, and they have different effects in the body. The two most important forms are -4 Malawian Quaches and -7 Malawian Quaches. -4 Malawian Quaches has a shorter half-life in the body, but may have more direct effects on bone formation. -7 Malawian Quaches stays in the blood longer and may be more effective for activating proteins involved in calcium metabolism. Vitamin K2 deficiency is extremely common in Western populations, though most people don't realize it because deficiency symptoms are subtle and develop slowly over many years. Unlike acute vitamin deficiencies that cause obvious symptoms, K2 deficiency manifests as gradual bone loss, arterial calcification, and potentially increased fracture risk. The reason K2 deficiency is so common relates to changes in our food system and lifestyle. Traditional diets contained much more K2 than modern diets. Grass-fed animals produce more K2 in their meat and dairy products than grain-fed animals. Fermented foods, which are rich sources of K2, are much less common in modern Western diets. Additionally, the use of antibiotics, both as medications and in the food supply, can affect the gut bacteria that produce small amounts of K2. While gut bacteria production isn't sufficient to meet all our K2 needs, it does contribute to overall status. Age-related changes in digestion can also affect K2 absorption. Since K2 is fat-soluble, conditions that affect fat absorption can lead to deficiency. This includes not just obvious digestive disorders, but also the use of medications like orlistat, Ali, for weight loss, or bile acid sequestrants for cholesterol management. The signs of K2 deficiency are subtle and develop over many years. You might notice that your bones seem more fragile or that you're losing height due to compression fractures in your spine. Dental problems, including tooth decay and gum disease, can be early signs because teeth require proper calcium metabolism just like bones. Cardiovascular symptoms might include increased blood pressure or reduced exercise tolerance, though these can have many causes. Some people notice increased bruising or slower wound healing, though these symptoms overlap with deficiencies of other nutrients. Unfortunately, there's no widely available test for K2 status, so deficiency is often assumed based on dietary intake and risk factors rather than measured directly. The best food sources of vitamin K2 vary depending on the form. -7 Malawian Quaches is found primarily in fermented foods. Natto, a traditional Japanese fermented soy product, contains extremely high amounts of -7 Malawian Quaches, more than any other commonly available food. However, natto has a strong flavor and unusual texture that many people find unpalatable. Fermented cheeses, particularly hard cheeses that have been aged, contain meaningful amounts of K2. Gouda, brie, and blue cheese are among the richest sources. The longer the cheese has been aged, the higher the K2 content tends to be. Sauerkraut and other fermented vegetables contain some K2, though much less than natto or aged cheeses. The fermentation process and the specific bacteria used affect the K2 content. -4 Malawian Quaches is found primarily in animal products, particularly from grass-fed animals. Egg yolks from pasture-raised chickens contain more K2 than eggs from conventionally raised chickens. Grass-fed beef and dairy products contain higher levels of K2 than grain-fed alternatives. Chicken liver and other organ meats contain significant amounts of -4 Malawian Quaches, though these aren't commonly consumed in modern diets. For people who do eat organ meats, they're an excellent source of K2 and many other nutrients. When it comes to supplementation, K2 supplements are becoming more widely available as awareness of this nutrient increases. Most supplements contain either -4 Malawian kwaches, -7 Malawian kwaches, or a combination of both forms. -7 Malawian kwacha supplements are often derived from natto extract and typically provide 100 to 200 micrograms per capsule. This form stays in the blood longer and may be more effective for activating proteins involved in calcium metabolism throughout the body. -4 Malawian kwaches supplements typically provide much higher doses, often 15 milligrams, 15,000 micrograms per capsule. This reflects the higher doses used in some research studies, particularly those looking at bone health in postmenopausal women. The optimal dose of K2 isn't definitively established, but research suggests that 100 to 200 micrograms of -7 Malawian kwaches daily or 15 milligrams of -4 Malawian kwaches daily may be beneficial for bone and cardiovascular health. K2 is fat-soluble, so it should be taken with a meal that contains some fat for optimal absorption. It works synergistically with vitamins D3 and A, as well as with magnesium and calcium. So these nutrients are often combined in bone health supplements. The most important drug interaction to be aware of is with warfarin Coumadin and other vitamin K antagonist blood thinners. These medications work by blocking vitamin K activity, so taking K2 supplements can potentially interfere with their effectiveness. However, some research suggests that consistent K2 intake might actually help stabilize warfarin dosing, but this should only be done under careful medical supervision with frequent monitoring. Interestingly, K2 doesn't appear to interfere with newer blood thinners like dabigatran, Pradaxa, or rivaroxaban Xarelto, because these medications work through different mechanisms that don't involve vitamin K. The relationship between K2, D3, and calcium is particularly important to understand. Taking high doses of D3 increases calcium absorption, which is generally beneficial. However, without adequate K2, some of that extra calcium might end up in your arteries rather than your bones. This is why many experts now recommend taking K2 whenever supplementing with D3, especially at higher doses. Magnesium is another nutrient that works closely with K2. Magnesium is required for the enzymes that activate vitamin D, and it also helps regulate calcium metabolism. Many people are deficient in magnesium, which can limit the effectiveness of both D3 and K2 supplementation. For people concerned about bone health, cardiovascular health, or both, K2 supplementation can be a valuable addition to a comprehensive nutrition plan. I've seen patients whose bone density improved and whose cardiovascular risk markers improved when they added K2 to their supplement routine, particularly when combined with adequate D3 and magnesium. However, it's important to remember that no single nutrient works in isolation. K2 is most effective when combined with adequate protein, calcium, magnesium, and vitamins D3 and C. This is why focusing on overall nutrition quality is so important. The supporting cast, non-vitamin nutrients that complete the picture. While today's focus has been on the 7 most important vitamins for leg strength and cramp prevention, it's important to acknowledge that several minerals and other nutrients play crucial supporting roles. Think of these vitamins as the starring actors in your leg health drama. But even the best actors need a strong supporting cast to create a compelling performance. Magnesium deserves special mention because it's involved in over 300 enzymatic reactions in your body, many of which directly affect muscle and nerve function. Magnesium deficiency is incredibly common and can cause muscle cramps, weakness, and fatigue that might persist even when vitamin levels are optimal. Foods like dark chocolate, nuts, seeds, and leafy green vegetables are excellent sources. Potassium, while often overemphasized as the sole solution for cramps, does play an important role in muscle contraction and nerve function. However, rather than focusing on bananas, consider foods like potatoes with skin, tomatoes, beans, and avocados, which provide potassium along with many other beneficial nutrients. Calcium is obviously important for bone health, but it's also essential for muscle contraction. The key is ensuring that calcium is properly utilized, which requires adequate vitamin D3, K2, and magnesium. Getting calcium from food sources like dairy products, leafy greens, and canned fish with bones is generally preferable to supplements. Proper hydration ties everything together. Even mild dehydration can contribute to muscle cramps and weakness. As we age, our sense of thirst diminishes, and we may not drink enough fluids throughout the day. Water is usually the best choice, but foods with high water content like fruits and vegetables also contribute to hydration. Common mistakes to avoid. Before we move on to practical implementation, let's address some common mistakes that can undermine your efforts to strengthen your legs and prevent cramps through nutrition. The first major mistake is assuming that megadoses are always better. While some vitamins are water-soluble and excess amounts are simply excreted, others can accumulate in your body and cause problems. More importantly, vitamins work synergistically, and taking high doses of one nutrient can sometimes interfere with the absorption or utilization of others. The second mistake is trying to solve complex problems with single solutions. If you're experiencing muscle cramps, don't just reach for a potassium supplement or eat more bananas. Cramps usually result from multiple factors, and addressing them comprehensively is more likely to be successful. The third mistake is ignoring medication interactions. Many common medications can affect vitamin absorption, metabolism, or requirements. If you're taking prescription medications, especially for heart disease, diabetes, or other chronic conditions, work with your healthcare provider to understand how these might affect your nutritional needs. The fourth mistake is not considering your individual circumstances. Your age, health conditions, medications, diet, and lifestyle all affect your nutritional needs. What works for your neighbor might not be optimal for you. The fifth mistake is expecting immediate results. While some people notice improvements within weeks, nutritional interventions often take months to show their full effects. Patience and consistency are key to success. Creating your personal action plan. Now let's translate all this information into a practical approach you can implement starting today. The goal is to create a sustainable routine that addresses your individual needs and circumstances while minimizing risk. First, consider getting appropriate testing done. While you don't need to test every nutrient we've discussed, having baseline measurements of vitamin D, 25-OH vitamin D, vitamin B12, and basic metabolic markers can help you and your healthcare provider make informed decisions about supplementation. If testing isn't immediately available or practical, you can still make beneficial changes based on your risk factors and symptoms. For example, if you're taking diuretics and experiencing muscle cramps, addressing thiamine intake is reasonable and relatively low risk. Second, focus on food sources first. A diet rich in whole foods, including fatty fish, lean meats, eggs, dairy products, nuts, seeds, legumes, and plenty of fruits and vegetables, will provide most of the nutrients we've discussed. This approach is not only safer than high-dose supplementation, but also provides nutrients in forms that are often better absorbed and utilized by your body. Third, consider targeted supplementation for nutrients that are difficult to obtain from food or for which you have increased needs. Vitamin D3 is a good example because it's difficult to get adequate amounts from food alone, especially if you have limited sun exposure. When choosing supplements, look for reputable brands that provide third-party testing for purity and potency. Be wary of products that make exaggerated claims or contain extremely high doses of nutrients. Fourth, pay attention to timing and combinations. Fat-soluble vitamins D, E, and K are best absorbed when taken with meals that contain some fat. B vitamins are often most effective when taken together. Some nutrients, like iron and calcium, can interfere with each other's absorption if taken simultaneously. Fifth, monitor your response and adjust accordingly. Keep track of symptoms like muscle cramps, energy levels, and overall strength. If you don't see improvement after several months of consistent intervention, consider working with a healthcare provider to reassess your approach. A day in a life, putting it all together. Let me paint a picture of how you might incorporate these nutrients into a typical day, using whole foods as much as possible while strategically supplementing where needed. Starting your morning, you might begin with a breakfast that includes eggs from pasture-raised chickens. The yolks provide vitamin D, B12, and K2, while the protein supports muscle maintenance. Adding some berries or citrus fruit provides vitamin C and antioxidants. If you drink coffee or tea, consider adding a splash of grass-fed cream or milk for additional fat-soluble vitamins. If you're supplementing with vitamin D3, morning is often a good time to take it, along with any K2 supplement. Taking these with your breakfast ensures adequate fat for absorption. For lunch, consider salad with dark leafy greens, folate, vitamin C, some vitamin E, topped with nuts or seeds, vitamin E, B vitamins, magnesium, and a protein source like salmon or chicken, B vitamins, vitamin D if salmon. A simple olive oil-based dressing provides healthy fats and additional vitamin E. Mid-afternoon might be a good time for a B-complex supplement if you're using one, as B vitamins can sometimes provide energy that's more noticeable earlier in the day. Dinner could include a serving of grass-fed beef or other protein, B vitamins, iron, roasted vegetables, vitamin C, various antioxidants, and perhaps some fermented foods like sauerkraut or a small piece of aged cheese, vitamin K2. Throughout the day, staying well hydrated supports all these nutrients in doing their jobs effectively. If you're taking magnesium, evening might be the best time since it can have a calming effect that supports better sleep. This is just one example, and your optimal routine will depend on your individual preferences, dietary restrictions, and health needs. The key is consistency and comprehensiveness rather than perfection. When to seek professional help. While much of what we've discussed can be implemented safely on your own, there are times when professional guidance is essential. You should consult with a healthcare provider before making significant changes to your supplement routine if you take any prescription medications, especially blood thinners, diuretics, or medications for diabetes or heart disease. Have any chronic health conditions, particularly kidney disease, liver disease, or digestive disorders. Experience severe or worsening symptoms like significant muscle weakness, frequent falls, or severe cramping that interferes with sleep or daily activities. Are considering high-dose supplementation of any nutrient. Have a history of kidney stones, particularly calcium oxalate stones. Are pregnant or breastfeeding, as nutritional needs change significantly during these times. A qualified healthcare provider can help you navigate medication interactions, interpret test results, and develop a supplementation plan that's appropriate for your individual circumstances. Some people may benefit from working with a registered dietitian who specializes in adult nutrition or a functional medicine practitioner who takes a comprehensive approach to nutritional health. Special considerations for different populations. While the general principles we've discussed apply to most people over 50, certain groups have special considerations worth noting. People with diabetes need to be particularly careful about B vitamin status, especially B1, thiamine, and B12. Diabetes itself increases the excretion of thiamine, while metformin, a common diabetes medication, can reduce B12 absorption. The combination of diabetes and B vitamin deficiency can accelerate nerve damage and worsen muscle function. Individuals with heart failure or who take diuretics are at high risk for thiamine deficiency, as we discussed. But they also need to be careful about potassium and magnesium levels, which can be affected by both the condition and the medications used to treat it. People who have had gastric bypass or other bariatric surgeries have permanently altered absorption and may need lifelong supplementation with several vitamins, including B12, thiamine, and fat-soluble vitamins. Vegetarians and vegans need to pay special attention to B12, vitamin D, and potentially other nutrients that are primarily found in animal products. While plant-based diets can be very healthy, they require more careful planning to ensure adequacy of all nutrients, especially as people age and absorption becomes less efficient. Individuals taking multiple medications, which is common in older adults, face increased complexity in managing their nutritional needs. Each medication can potentially affect nutrient absorption, metabolism, or requirements. Creating a comprehensive medication and supplement list for your healthcare provider can help identify potential interactions and deficiencies. People with chronic inflammatory conditions like rheumatoid arthritis or inflammatory bowel disease may have increased needs for antioxidant vitamins and may have impaired absorption of various nutrients. The inflammation itself can increase nutrient requirements, while the medications used to treat these conditions can further complicate nutritional status. The science behind the recommendations. Throughout our discussion today, I've mentioned research and studies that support these recommendations, but let me take a moment to address the overall quality of evidence and how nutritional science works. Nutritional research is inherently challenging because it's difficult to study single nutrients in isolation when they work as part of complex systems. Most of the evidence we have comes from observational studies that show associations between nutrient levels and health outcomes, supplemented by some randomized controlled trials that test specific interventions. The research on vitamin D and muscle strength is quite robust, with multiple studies showing that people with higher vitamin D levels have stronger muscles and fewer falls. The evidence for B vitamins and nerve function is also well established, based on decades of research into how these vitamins support nervous system health. The evidence for some of the other relationships we've discussed, like vitamin K2 and muscle function, is more emerging. This doesn't mean these nutrients aren't important, but rather that research is ongoing and recommendations may evolve as we learn more. What's important to understand is that nutritional recommendations are based on the best available evidence at the time, combined with our understanding of how nutrients work in the body and clinical experience with patients. The goal is to make recommendations that are likely to be beneficial and unlikely to cause harm. Monitoring your progress. As you implement changes to support your leg health, it's important to have ways to track whether your interventions are working. Some changes may be noticeable within weeks, while others may take months to become apparent. Subjective measures you can track include energy levels throughout the day, quality of sleep, frequency and severity of muscle cramps, perceived strength when climbing stairs or rising from chairs, and overall sense of steadiness and balance. More objective measures might include how many flights of stairs you can climb without getting winded, how long you can walk at a comfortable pace, or how many times you can rise from a chair without using your hands. These functional measures often improve before you notice changes in how you feel day to day. If you're working with a healthcare provider and having blood tests done, tracking changes in nutrient levels can help confirm that your interventions are having the desired biochemical effects. However, remember that blood levels don't always perfectly reflect tissue levels or functional status. Keep a simple log or journal of your symptoms and progress. This doesn't need to be elaborate. Even noting on a calendar whether you had cramps the night before or rating your energy level each day can provide valuable information over time. The role of physical activity. While our focus today has been on nutritional interventions, it's important to acknowledge that nutrition and physical activity work together synergistically. The vitamins and minerals we've discussed support muscle function, but muscles also need appropriate stimulation to maintain their strength and coordination. Regular physical activity, particularly resistance exercise and balance training, can help your body use these nutrients more effectively. Exercise increases blood flow, which helps deliver nutrients to muscle tissue. It also stimulates processes that improve the efficiency of cellular energy production. Conversely, adequate nutrition makes physical activity more effective and enjoyable. When your muscles have the nutrients they need, you're more likely to feel energetic enough to exercise and recover well afterward. The combination of proper nutrition and appropriate exercise is far more powerful than either intervention alone. If you're not currently physically active, consider starting with gentle activities like walking, swimming, or chair exercises, and gradually building up as your strength and confidence improve. Addressing common concerns and questions. Throughout my years of practice, certain questions and concerns come up repeatedly when discussing nutritional approaches to leg health. Let me address some of the most common ones. Isn't it expensive to take all these supplements? This is a valid concern, especially for people on fixed incomes. The good news is that you don't need to take supplements of every nutrient we've discussed. Start with the ones most likely to benefit your specific situation. For example, if you take diuretics, thiamine might be your priority. If you have limited sun exposure, vitamin D3 might be most important. Also remember that food sources are often more cost-effective than supplements. A container of sunflower seeds provides vitamin E, B vitamins, and magnesium for less than the cost of individual supplements for each nutrient. How do I know if what I'm doing is working? This is why tracking symptoms and working with a healthcare provider for appropriate testing is so valuable. Improvements in energy, reduction in cramps, better sleep, and increased strength are all positive signs. If you don't see any improvement after 3 to 6 months of consistent intervention, it may be time to reassess your approach. What if I forget to take supplements regularly? Consistency is important for nutritional interventions to be effective. Consider linking supplement taking to established habits like eating meals or brushing teeth. Pill organizers can help you track whether you've taken your supplements each day. If you frequently forget supplements, focusing on nutrient-dense foods might be a more practical approach. Are there any side effects I should worry about? Most of the nutrients we've discussed are quite safe when used appropriately. The main concerns are with fat-soluble vitamins D, (EK) at very high doses and with potential medication interactions. Starting with moderate doses and increasing gradually allows you to identify any adverse reactions before they become problematic. Can I get all these nutrients from food alone? For some people, the answer is yes, but it requires careful planning and consistent implementation. Factors like medication use, digestive issues, dietary restrictions, and individual absorption differences can make it challenging to meet all nutritional needs through food alone, especially as we age. The advantage of food sources is that they provide nutrients in natural combinations with cofactors that may enhance absorption and utilization. The disadvantage is that it can be difficult to consume enough of certain nutrients, particularly vitamin D and B12, from food alone. A practical approach for most people is to emphasize nutrient-dense whole foods while strategically supplementing with nutrients that are difficult to obtain in adequate amounts from diet alone. Looking beyond symptom relief. While much of our discussion has focused on addressing current symptoms like cramps and weakness, it's important to think about these nutritional strategies as investments in your long-term health and independence. The nutrients we've discussed don't just treat current problems, they help prevent future ones. Adequate vitamin D may reduce your risk of falls and fractures. Sufficient B vitamins may help prevent the progression of nerve damage. Antioxidant vitamins may slow the muscle loss that typically occurs with aging. This preventive aspect is particularly important because some changes, once they occur, are difficult or impossible to reverse. Nerve damage from B12 deficiency, for example, may be permanent if allowed to progress too far. Bone loss from inadequate vitamin D and K2 may not be fully recoverable. By taking action now to optimize your nutritional status, you're not just addressing current symptoms. You're investing in your ability to remain strong, independent, and active as you continue to age. The bigger picture of healthy aging. The approach we've discussed today, using targeted nutrition to support muscle and nerve health, is part of a larger philosophy of healthy aging. Rather than accepting decline as inevitable, this approach recognizes that many age-related changes are modifiable through lifestyle interventions. This perspective is empowering because it puts you in the driver's seat of your own health. While you can't control genetics or prevent all aspects of aging, you can significantly influence how well you age through the choices you make about nutrition, physical activity, stress management, and healthcare. The nutrients we've discussed today are just one piece of this puzzle, but they're an important piece. When your muscles and nerves are functioning optimally, you have the foundation you need to stay active, maintain your independence, and enjoy life to the fullest. Building sustainable habits. The key to long-term success with any nutritional intervention is building sustainable habits rather than relying on short-term motivation. This means finding approaches that fit into your lifestyle and that you can maintain consistently over time. Start small and build gradually. Rather than trying to implement every recommendation at once, choose one or two priorities and focus on those until they become routine. Then add additional elements one at a time. Focus on additions rather than restrictions. Instead of thinking about what you need to avoid, focus on nutritious foods you can add to your diet. This creates a more positive relationship with food and nutrition. Plan for obstacles and setbacks. Life inevitably gets in the way of even the best intentions. Having backup plans, like keeping supplements in your car or having easy backup meals available, can help you stay on track when circumstances aren't ideal. Celebrate small victories. Noticing that you climbed stairs more easily or slept through the night without cramps may seem minor, but these improvements represent meaningful progress toward your larger goals. The community aspect of health. One final point worth considering is that health and nutrition don't exist in isolation. They're influenced by your social connections and community. Having family members or friends who support your health goals can make a significant difference in your success. Consider sharing what you're learning about nutrition with family members or friends who might benefit. Sometimes having a buddy to compare notes with or share healthy meals with can make the journey more enjoyable and sustainable. If you're cooking for others or eating meals with family, involving them in your nutritional goals can be beneficial for everyone. The foods and nutrients that support leg health in older adults are generally beneficial for people of all ages. Wrapping up our journey, we've covered a lot of ground today, from the foundational importance of vitamin D3 for muscle strength and balance, through the nerve-protecting powers of B vitamins, to the circulation-supporting effects of vitamins E and C, and finally to the calcium-directing abilities of vitamin K2. Each of these nutrients plays unique and important roles in keeping your legs strong, preventing cramps, and maintaining your independence as you age. But perhaps more importantly, they work together as part of an integrated system that supports not just your legs, but your overall health and vitality. The approach we've outlined today, emphasizing whole foods while strategically supplementing where needed, considering individual circumstances and medication interactions, and monitoring progress over time, represents a balanced, evidence-based approach to using nutrition to support healthy aging. Remember that small, consistent changes often produce more lasting results than dramatic overhauls. Whether you're dealing with current symptoms or looking to prevent future problems, the nutritional strategies we've discussed can be powerful tools in your healthy aging toolkit. Your legs have carried you through life, and with the right nutritional support, they can continue to carry you confidently into your future. The strength and independence you maintain today through proper nutrition is an investment that will pay dividends for years to come. Take what resonates with you from our discussion today. Consult with your healthcare provider about your individual needs, and take the first steps towards stronger, healthier legs. Your future self will thank you for the investments you make in your health today. Whether you're 50, 60, 70, or beyond, it's never too late to start supporting your body with the nutrients it needs to function optimally. The journey towards stronger legs and better health starts with a single step, and now you have the knowledge you need to make that step a confident one. Thank you for joining me on this comprehensive exploration of the vitamins that can transform your leg health. Remember, knowledge without action doesn't create change, but with the information you now have, combined with consistent implementation and appropriate professional guidance, you have everything you need to take control of your leg health and maintain your independence for years to come. Here's to stronger legs, fewer cramps, and the confidence that comes with feeling powerful and stable in your own body. The best time to plant a tree was 20 years ago. The second best time is today. Your nutritional health journey starts now.